Welcome to today's event, which is Pathways for Policy Experts and Stakeholders. My name is Diana McCullum, and I'm the Project Director for the Pathways Clearinghouse. And one of my key roles is leading engagement with Pathways Clearinghouse stakeholders. And that includes employment service providers, policy experts, and other stakeholders they liaise with, TANF administrators, and researchers. So the Pathways Clearinghouse really is intended for a very wide audience. And we're just really grateful that you found the time to join us for today's presentation. Since the Clearinghouse launched this summer, we've really been actively working to make sure that each of the key stakeholder groups that we have has information about the website and has a sense of how it can help support evidence-based decision-making. So this is really the first event that we've had specifically for policy experts. And those that work closely with policymakers. And the idea is to help provide some questions and address questions that may come up as you approach the website. We really want this to be a resource for those that are looking at evidence for the different services that help people succeed in the labor market and show you how you can use this tool to sift through the evidence. So before we get going, I'll turn it over to Kim Klum, who's our project officer at OPRE, to share some additional opening remarks.
Thank you so much, Diana. So I'm very pleased to be here this afternoon and to be sharing the Pathways to Work Evidence Clearinghouse with such an important stakeholder group for us, those who work to create or implement policies and those who provide guidance and assistance around policy efforts. The Pathways Clearinghouse reflects a great deal of thorough, careful, and thoughtful work by our team, which is a team made up of staff from the Office of Planning, Research and Evaluation, and Mathematica and Mathematica's partners. To create the Pathways Clearinghouse, the team consulted broadly, learning from the experience of other evidence clearinghouses and from the perspective of potential users of the clearinghouse. The result is a very rigorous review, as I hope you'll learn from Diana's discussion of it, that presents a great deal of sometimes complex information in ways that are designed to be transparent and easy to understand. We were fortunate that we were able to build on an existing effort by our office, the Office of Planning, Research and Evaluation, which was entitled the Employment Strategies for Low-Income Adults Evidence Review, and we were very happy to get a statutory mandate to continue to build on that work. The Pathways Clearinghouse is meant to be a resource for practitioners, policymakers, and other stakeholders, as Diana outlined. But in order for it to be useful, potential users have to know about it. So it's really gratifying to have this opportunity to share the Clearinghouse specifically with this audience. I also want to thank our panelists in advance for the conversation we're about to have, which will be about the relevance of pathways to their policy worlds and to their stakeholders. And I'm very much looking forward to the conversation. And with that, I'll hand it back to you, Diana.
Great. So I'll start out by sharing a broad overview of what we want to accomplish for today's webinar. First, as Kim mentioned, we've assembled panelists that have experience with crafting policy and then providing direct technical assistance to governor staff and other policymakers. So just welcome to everyone. And then I'll start out by providing a little bit of brief background on the Pathways Clearinghouse to give you a sense of how the project started and what the primary goals are. And then I'll walk through a website demonstration to give you a sense of how you can use the website to answer some specific questions. And then we'll turn over to the panelist discussion portion, and we'll end with questions and answers from the audience. So if you have questions, please, you can feel free to submit them throughout, and we will get to them at the end of the panel discussion. All right. So I will start off by introducing our panel. So as I mentioned, Kim Klum is the project officer for the Pathways Clearinghouse, and she's a senior social science research analyst at OPRE. Her work focuses on adults with low incomes, economic self-sufficiency more broadly, and the application of the behavioral sciences to human services, as well as race and ethnic disparities. We also have Nick Hart, who's a Pathway stakeholder and the Chief Executive Officer of the Data Coalition and President of the Data Foundation. He helped craft the milestone Foundations for Evidence-Based Policymaking Act including the Open Government Data Act, and he worked with numerous federal agencies and congressional committees to design effective data, evaluation, and privacy policies over the past decade. We also have Rachel Stevens on the panel, and she serves as the Director of Workforce Programs with NGA Center for Best Practices, where she serves as an advisor to state leaders on workforce development and education policies. Rachel oversees projects and technical assistance provided to governors and state staff on policymaking issues that include the future of work and technological disruption, work-based learning, apprenticeship, youth apprenticeship, occupational licensing, and disability employment. So we're very excited to have our panel today. All right. And we just wanted to start off with a brief poll just to get a sense of the audience and how much exposure you may have had to the Pathways Clearinghouse so far. So if you can just answer this brief poll, we would just like to know whether you attended the Pathways Clearinghouse webinar on July 15th. That was our launch event. You can do that and then just hit submit. Give everyone a brief moment. Okay, great. I mean, well, this is helpful. It looks like a fair number of folks have not attended the launch event, which is helpful. I think we have some information that we can give you some background and grounding in the Pathways Clearinghouse, and we can also point folks to the launch event as well as other resources if you want to go back from things like a more extended website demonstration, for example. So with that, I'll start with a brief overview of the Pathways Clearinghouse. So as Kim mentioned, the Pathways to Work Clearinghouse began through the Consolidated Appropriations Act of 2017, and that was an act that directed HHS to create a database of projects, which we call interventions, that have used a proven or a promising approach for moving welfare recipients into work. As part of that act, the interventions needed to be characterized according to their evidence of effectiveness. So that means whether the interventions, for us, these are the terms that we've used, it's whether the interventions have outcomes that are supported, or whether the outcomes are well supported, or more research is needed. In addition, HHS had to establish criteria for each of those specific categories and create a public database of the findings. So now I'll talk a little bit about the goals of the Pathways Clearinghouse. And the idea is really for this resource to be a user-friendly website that meets the needs of administrators, practitioners, and policy experts to support the use of evidence-based decision-making. So there are 4 key goals for the Pathways Clearinghouse. And the first is starting out with systematic review of the impact evaluation literature on employment and employment-focused training interventions for individuals that have low incomes. And the review needs to be transparent and comprehensive. The next step in the process is to rate the interventions that were identified through the review according to pre-screened criteria to determine if the interventions demonstrate evidence of effectiveness in improving outcomes. And our full list of ratings for outcomes are well supported, supported, not supported, having mixed support, insufficient evidence, or no evidence to assess support. And we apply each of these ratings to specific outcome domains within the employment literature. So specifically, we're interested in impacts on employment, increasing employment, increasing earnings, reducing public benefit receipt, and increasing education and training. The third goal of the Pathways Clearinghouse is to present information on a high-quality, user-friendly website that presents the review's findings and then also starts to provide some additional materials that can make it easy for users to navigate. So I'll talk about that when we get to the demo. And in addition to information on interventions, the site will also have some information about syntheses of different approaches that are common within the literature. And will also include some videos, both to show users how they can navigate the website, and in the future, providing specific examples of how you might use the website and formulate specific questions. So last but not least, an active goal of the Pathways Clearinghouse is to focus on dissemination and continuing to promote the use of the website across the multiple target audiences. We really want to make sure that all key stakeholders are aware of this tool and aware of different ways that they can use it. And one thing I wanted to mention, that obtaining stakeholder input has really been central to our work on this project, and it's been a guiding principle for this clearinghouse. It's really been informed, as Kim mentioned, by the wisdom of other existing evidence reviews. We work in coordination with them, but also by the guidance of end users. And so our stakeholder group has really included a combination of TANF administrators and other direct employment service providers, policy experts, and researchers who have helped us think about the scope of the review, but also testing the website and ensuring it's something that is accessible. So based on the Consolidated Appropriations Act, Pathways focuses on interventions that are designed to improve family self-sufficiency through employment and training services. The Pathways Clearinghouse focuses on interventions for low-income individuals, but it's not limited to TANF recipients. It's for individuals that have low incomes more broadly. The scope is also limited based on time period and setting. So research must have been released in 1990 or later. And for the setting, we include studies conducted in the United States and Canada. And as Kim was mentioning, the Pathways Clearinghouse really builds on a previous work conducted under the Employment Strategies for Low-Income Adults Evidence Review, or ESER. And it also shares similar standards to other prominent reviews, such as the Department of Labor's CLEAR and the Department of Education's What Works Clearinghouse. So similar standards in terms of how to identify how you would determine what makes a study high quality or moderate quality. All right. And I'll just talk very briefly about some of the future products that we're working on. As you can imagine, the Pathways Clearinghouse contains a large database of information across multiple interventions. And so we're working on several products that sort of start to synthesize the information across interventions. So one of the first products will be synthesis briefs. And these will address what we know about different approaches and different service types that are used across employment programs. So for example, approaches like employment coaching, for example, will be some that we focus on in these synthesis briefs. We'll also produce synthesis reports, which will describe the extent of evidence on employment-focused programs. So these will be reports that really feature meta-analysis, for example, and again, look broadly at the set of interventions and begin to ask specific questions across all the interventions that we've examined. And we'll also have special topics reports that really appeal to questions that may be of interest across stakeholders. And those can include a wide range of topics. And again, they'll address sort of pressing questions that have emerged when conducting the review, and think about the larger issue of how evidence is built in this field and what suggestions might be helpful for future research. So more to come on our future products. All right. So now I'll take you to a brief demonstration of the website. And we wanted to start with a couple of focal questions to orient this demonstration, and thinking of questions that might be of of interest for policy experts. So one question might be, what types of programs improve earnings? And you also might be interested in finding out the extent to which an effective program actually improves earnings. I will go ahead and switch over to the demo. Okay. So this is the home page for the website, pathwaystowork.acf.hhs.gov. And we encourage folks to take a look at the website, certainly, and browse around and see if you have questions. But for this demo, I'll just briefly walk you through how we will answer those questions of thinking about what types of programs improve earnings and how much might they improve earnings. And to address that, we'd start with the Find Interventions That Work tool, which is available here on the home page. And this tool summarizes all information available across the interventions that we've reviewed as part of the systematic search that I spoke about earlier. So to start this off, I'm just going to go through some of the filters that we might use when we're thinking about that question of improving earnings. We have this filter where you can select the specific outcomes that you want to improve. So for the purpose of this, let's look at increasing earnings, whether in the short term, long term, or very long term. And I will just mention briefly, you may be interested in searching by other characteristics. For example, different characteristics that might describe particular populations that programs serve, or different services that might be provided, such as case management or different health services and work-based learning. But just to stick to our question, you can select the filter that you're interested in and hit apply. And that takes us down from, we had 161 interventions that were included, but this brings you down to 49 interventions that have at least one supported outcome for increasing earnings. So that's what this list populates. And just wanted to give you a broad snapshot. So these are the interventions that have at least one supported outcome for increasing earnings. And what that means is that there's at least one study for the intervention that has a favorable, positive, statistically significant finding for earnings. But you also might be interested in looking across these interventions, what the impacts are on other outcomes, such as employment, or decreasing benefit receipt and increasing education and training. So the Find Interventions That Work tool is designed so that at a snapshot view, you can look at all of those outcomes. And we also draw out information that identifies for each intervention, what the specific populations are and their specific employment barriers. So you can see for this first one, the population included cash assistance recipients, parents, for example. And then you can also get a snapshot of the different services provided across interventions. So I'm going to go ahead and select some interventions that we can start to look at a little bit further. One of the nice features that we've added here as well is that you can actually compare information across interventions. So let's say we'll start with Good Transitions, Grand Rapids Labor Force Attachment, and Indiana Welfare Reform Initiative. So if you're interested in comparing those interventions further, you'd select them and then go up and hit this Compare Selected button. And this view gives you a sense of, across these interventions, sort of a side-by-side view of what the focus is for each intervention, the specific populations that are served, and the different services that are provided across each. Again, intended to take you from the extended view of multiple interventions so that you can begin to think about the features of a smaller set of interventions. We also provide information on this page about the rating and effect of the intervention in 2018 dollars and percentages. So let's look at these three interventions across an array of outcomes. So the first thing that you notice is that each of these interventions has a supported rating for earnings. Second, looking at this table, you can start to understand the difference in the magnitude of those impacts across these interventions. So this is starting to get us at the question that we have to understand of how much might an effective program improve earnings. Through the information on the site, we wanted users to be able to compare the magnitude of interventions in an easy to understand manner. So we calculated the standardized effect sizes for each of these interventions and then mapped them to the effect sizes, and then map the effect sizes onto the distributions of outcomes in a representative reference sample. So here you see that Grand Rapids LFA improved earnings by about $3,117 a year compared to $1,632 for the Good Transitions program and $1,046 for the Indiana Welfare Reform Initiative. And you might also be interested in looking at other aspects of the outcomes, such as the programs that improve long-term earnings. And I'm not going to go into detail here, but you can also see, we focused on earnings for this particular example, but you can also, in this sort of snapshot view, also see the impacts across the other primary outcomes that we focus on. So for employment, decreasing benefit receipt, and education, increasing education and training. And so after looking across this information on the interventions, this gives you a very high level view, but you can click on any of the interventions to find out more detailed information about the specific intervention. So if we take a look at Indiana Welfare Reform Initiative, this is sort of a snapshot of an intervention specific page, and other intervention pages sort of mirror this same format. We have information about the goal of the intervention, and then provide a little bit more extended detail about the specific population of focus, the target services that were included, and begin to give users a sense of the duration of the intervention, for example. And this is the intervention page for this particular program, and it shows that effectiveness rating information across all of the domains, again, but specific to this particular intervention. One other thing to draw your attention to, for those interventions that have at least one of these supported outcome ratings, again, signaling that there's at least one study with a positive and statistically significant finding in a particular outcome domain. For those interventions, we're beginning to add to the website implementation details. So you have information about the specific organizations that were implementing the intervention, specific added details about the population served, and a more robust description of the services that were offered. So this just provides you a snapshot of some of the information that you see for those interventions. All right. And I'm going to wrap up the demonstration. I just wanted to point out one thing. We do have other extended demonstrations in case you're interested. If you go to other Pathways resources and publications, you can also find our launch event here, and there's more extended demonstrations offered there and other examples. Okay. All right. So now I'm going to stop sharing my screen and turn us over to the panelist portion of the discussion.
Great.
All right.
Thank you.
So Kim, over to you. Sure. Mm-hmm.
Thank you. Thanks so much, Diana. Thanks for such a great overview and introduction to what the Pathways Clearinghouse is. So I hope that you who are in the audience for this webinar now have kind of a big picture sense of what's in the Pathways Clearinghouse and some of the ways that it can be useful to you and what the kind of information you can find in it. But we really wanted to talk to folks who are very who are very well respected and big experts in this field in their respective domains, to kind of talk about how Pathways makes sense to stakeholders who might try to be using it, and how it can be relevant to the kind of day-to-day work of policy making and policy adjacent work. So as Diana mentioned, I'll start first of all with a question for Nick. I'll ask you a couple of questions. I'll ask Rachel a couple of questions, and I have some questions for both of you together. But Nick, as Diana mentioned, you were very instrumental in passing the Foundations for Evidence-Based Policymaking Act, an act which is beginning to have big ripples across all federal agencies right now, as federal agencies are implementing the act. Can you tell us a little bit about why the use of evidence and evidence-informed policymaking is so important at the federal level, among federal agencies and Congress as well?
Well, yeah, of course. And I guess I would start by saying I don't think it's just important at the federal level. This is important at every level of government, also in the private sector and in nonprofits, that as a society, the more that we can generate evidence that can be meaningfully used to guide and inform decisions, the more likely we are to have this cycle of continuous learning and improvement. And that's really what the goal here is about, creating mechanisms for disseminating knowledge more efficiently. So for those of you who are out there in decision-making roles, you're not just handed something as a one-off study, but you have access to a range of information that can be used to guide wherever your decision-making process is. And we've seen this happen a lot more in the federal government over the last decade. A lot of it's driven by resource demands and a recognition that there's not an infinite amount of money out there to implement these programs, but also that we are meaningfully trying to achieve outcomes and objectives that are specified to improve the lives of the American people. And if we're going to truly do that, evidence is going to be a central ingredient for successfully accomplishing that goal.
Yeah, so that's really helpful. That's a really nice way of understanding why it's so important to kind of drive in this direction. And so how do you think that something like the Pathways Clearinghouse can kind of help contribute to that national trend towards using evidence and data more frequently in policymaking?
So I like to say you can't use evidence you don't know exists or you don't have access to, right? So the Pathways portal really establishes this immediate public access to information, and does so in a fairly, I would say, intuitive way, where you don't have to spend 3 hours on a tutorial figuring out how to navigate and what things mean. And so for decision makers, the staff of governors or folks at the local program administrator level, you're all busy and you have a lot on your plates and day-to-day operations and important decisions in front of you and a whole host of policy domains. So having rapid access is also important, where you can quickly distill based on the criteria and objectives or goals that you have, but with enough context to make it meaningful for you. And that's exactly what Pathways accomplishes.
Thanks, Nick. That's really helpful. Thank you so much. Rachel, I'm going to turn to you now, because although Nick did a great job of saying this isn't just an issue at the federal level, of course, we want everybody at all different levels and outside government as well to be using more and more evidence. But Rachel, you really specialize in working with states. You work directly with governors and their staff, advising these state leaders on workforce development and education policies. So can you tell us a little bit about how states try to use evidence to inform decisions that they make about policies and programs?
Yeah, absolutely. Thank you so much for having me be part of this conversation. I was really excited to see this tool be released and to dig more into how states are and can be using evidence like this, and especially in the way this tool provides it. Governors, as Nick pointed out, like so many other policymakers across all levels of government, are really interested in understanding what works on behalf of their constituents. Knowing there's limited resources, being able to say this has a high return on investment, this has the specific outcomes for the specific people that I know need it most in my state, is really powerful, and it's really important. And I think, it's been challenging at times for states to feel like they have adequate data across a range of programs that individuals may interact with, to really be able to compare and contrast what seems to work well, what could be scaled, right? They also don't want to be missing something that's really impactful in a local community that they could be scaling statewide and just don't even know about. So I think for states, especially knowing that in the coming year or few, they're going to be facing really tough budget decisions. They're going to have to make cuts as most states are required to maintain balanced budgets. Being able to make those decisions based on what's having desired outcomes for people, especially when it comes to economic participation and wages and economic security, is just something that's so desperately needed and something states have really been working toward in their own state data systems. And we are big proponents of, the more resources we can share with states to help them identify solutions in their state or others that they could be thinking about is just really beneficial to the work that so many states are embarking on right now.
And in terms of being able to kind of make use of evidence, are there particular kinds of barriers that states face, that governments and their staff face in trying to use evidence to inform decision making?
Yeah, there's probably a few, and Nick touched on some of them. The first is having access to it, having it be digestible, having it be all in one place. A lot of people in the policymaking world aren't data or database experts themselves. A second challenge that kind of relates to that is the fact that within states, data on each program and each program's performance is so dispersed across agencies in most cases. And within agencies or departments, it may be dispersed across specific programs or administrative staff. And so being able to look across the breadth of programs, if you're in a governor's office, you don't care about whether it's this department or that department administering the program. You want to know what's going to work. And so being able to do that kind of apples to apples comparison across different data systems that you may be administering within your state is such a challenge and a barrier. And it's one states are working through, and there's definitely some examples of success that states are having in kind of integrating their data systems so they can look at this more holistically. But even so, it just continues to be a challenge. And I think that's certainly one of the biggest barriers, really being able to do a comparative analysis of, just what evidence is out there on programs of different types.
Thanks. That's really interesting and really helpful to think about it in that very concrete way. Are there ways that you think that Pathways can kind of specifically help address some of those barriers?
Yeah, absolutely. It's, one reason I was so excited to see this resource. There are a few things that really stood out about it to me, knowing the types of questions my team gets from governor's offices that they're seeking advice on, as well as the questions that the individuals within state government we work with typically are asking themselves or trying to look into. One is certainly that, there's so many different types of programs encompassed in one place, whether it's a program administered by a workforce agency or a human services agency, you name it. Another is that they can really use this tool in a way that can help them understand, okay, if I have funding that I know can support work-based learning, if I have funding that I know can support job search assistance, they can actually filter. The way that the tool is structured, they can filter by those services, by those types of programs that they know they have funds to target, because sometimes that's a factor in how these decisions are made, right? A lot of funds states use aren't that flexible. So being able to say, okay, if I need to spend some funds on job search assistance and people really need that, what models out there are really working? What's the evidence saying about these different models? Being able to quickly access that type of information and get a comparison that not only, is grounded in just some of the raw outcomes data, but in many cases links directly to studies, robust studies of those programs, just is incredibly impactful. I want to underscore the fact that for governor's offices in particular, when they're making budget recommendations to their state legislatures, if they have a data point they can point to say, this is why I'm asking the state to invest scarce resources in this type of program, that's really meaningful. And whether it's something that they can point to in their own state or model they're borrowing from another state, being able to do that and having a reliable source of information with which to do that is absolutely crucial. So I think that those are some of the ways that, this tool in particular is really well structured to help be a resource that states can use to get that type of information.
Thanks, Rachel. That's also very helpful. And then I just want to kind of broaden it back out to Nick as well, to bring Nick back in. But, you mentioned there's some specific features that you particularly touched on just now that Pathways has. And I just wondered, from both of you, are there particular ways in which information is structured on Pathways that you think is potentially most relevant or most useful or could be most helpful to folks in either of your worlds?
Yeah, I'll jump in. I think, there's a lot to be said about the features being very well thought out from a user design perspective. And you just heard Rachel maybe offer some quick hits of some of the things I would also just echo and agree with. The simplicity and clarity of the clearinghouse cannot be missed. As someone who's worked with the federal government for a long time, that's not something we can always say in such a positive way about government design sites. And so, truly from a user perspective, it's easy to kind of dig in really fast. But I would also stress that the fact that the studies that are there have also been reviewed by experts and been given ratings to help those who are in the decision-making process try to understand and make meaning of, like, how do you think about this quality? Like, I'm a PhD program evaluator by training, but most people who are working in congressional offices or around the country in a variety of decision-making roles aren't PhDs in X, Y, and Z. And so having those who are, really honing in on the methods, doing good, high-quality assessments of what the studies actually mean from a technical side, I think is particularly beneficial as we, societally, collectively are struggling with this issue of credibility and, trying to figure out what is truth. Well, this is a resource now for you on the outcomes that you probably care about the most for some of these programs, where others have contributed to providing some insights about that. Maybe the last thing that I would offer from putting on my old policymaking hat for when I worked for the White House is, I think the fact that the outcomes are easily filtered here is really, really poignant. So in some cases, we're trying to get people employment, but it's not good enough to just say they got a job. We want to make it meaningful so that it can truly impact income and earnings. And the ability of the clearinghouse to be able to delve into both of those things for someone like a non-custodial parent, where they really need both of those ingredients together, is really impactful if you're on the ground trying to figure out how to have a program that fits the context that you're operating in. And so that filtering ability that Rachel also mentioned, I think is just so powerful. You're trying to find interventions that make sense in your own particular context.
Thanks, Nick. And Rachel, what about you? Are there any other features you might highlight or want to focus on?
Yeah, well, I just would absolutely underscore the points Nick raised, especially about the studies and being able to have that kind of sense of, how good is this data? Not just we have data points, how reliable is it? The variety of both the very simple indicators and the ability for decision makers to access more details if they want it. I love that combination in this tool. And he also pointed out kind of being able to, look at the longer term impacts and things like wage changes and job retention. And those are things that are often harder to come by. You have to do digging. Maybe you have to call someone. Often we have to wind up connecting with people personally to get some of that information. If we're looking across states, for instance, to support governors in a request they have. So those two things I just want to absolutely underline that are just, I think, the cornerstones of this tool. A smaller item I would mention that I really appreciated based on the kinds of questions we see being asked very frequently is that there's an urban and rural settings that I actually didn't notice the first time I was on the site, but it's there in that kind of gray box to the right when you're looking at some of the examples, what type of settings this has been tested in. And that is really helpful because eventually someone's going to ask that question if they're looking at kind of borrowing from a program model. They're going to want to know that information, and being able to have that up front before you get too far down the process of thinking it through. I absolutely love that. So I wanted to also flag that for people on here who are thinking about how they're going to make use of this and make sure that you notice that as well.
Thanks so much for highlighting that feature in particular. And kind of a little bit bouncing off that point a little bit, we think of Pathways, we're trying to make it as dynamic a resource as possible. So there are two kinds of pieces to that. One of which is the efforts that we're undertaking to try to make, to continue to enhance Pathways and to have it be as responsive as possible to users' needs. So I'll just kind of preview that we have been actually thinking about how we can do more filtering and provide more options for people to find interventions based on the kind of locality of the country that they were tested in. So kind of even providing more information on that. But speaking also in another way of how we want Pathways to be dynamic, we want it to be dynamic in terms of how it responds to changing conditions and to changing needs from users for different kinds of information. So right now, the biggest change, obviously, is what's happened as a result of COVID-19 and the kinds of, as you were saying, Rachel, you were kind of suggesting the impact that's going to put on states' budgets, but just in general. Oh, was I on mute that whole time? No. Sorry.
Kim, I think at some point we lost your audio.
Yes, we did lose you for a second.
I'm so sorry.
It was you, Kim.
Sorry. I don't know what I did.
That's okay.
I was trying to talk about how we were hoping it was a dynamic. So I hope you probably heard some part of that. I'll just ask you the question. But given the historic unemployment and uncertainty caused by COVID-19, particularly for families with low incomes, what are some of the priority questions that policymakers might be having or that you've been hearing about in relation specifically to kind of employment or employment programs? And are there some ways in which you think Pathways can be a resource that could help answer those questions?
Yeah, I'd be happy to start on this one, Nick, and if that's all right, I'm sure you'll have a lot to add. I think a couple things I'll touch on. One is going back to the cost issue and just understanding kind of, that return on investment piece just is extra critical. It's always important, but I think it's just even more critical in a time like this. And knowing that many of the low-income workers that this tool is focusing on are really those most in need of supports and services during this time and for the foreseeable future. I think being able to rapidly identify what's really having a high return on investment is going to be absolutely crucial. I also think being able to quickly identify how and through what streams that work's being funded will be crucial, again, because states are going to be thinking about how do I piece together all of these different, components. And on the final point I wanted to share was, thinking longer term about recovery. States are going to want to know, what can I act on quickly? What's going to get people back in the workforce pretty quickly, but also have a positive long-term impact, not just be a quick fix and have that be all it is. And having some of that longer term data here, I think, can help start to answer that question, at least point in some good directions.
Yeah, that's great. And please add to that if you have.
Well, I would add, we know the pandemic has not hit society equitably. There are a lot of disparities when we look across subgroups of population, and that's true even among low-income households. I think this is one of the powerful aspects of the clearinghouse in the contemporaneous environment, which is there's some ability to do stratification of demographic or societal characteristics that might be relevant or more relevant in some jurisdictions than others, but let you sort of target the particular cohort of the population that might be in the most need based on a particular intervention. Full disclosure, it probably doesn't address everything that everybody would possibly want in responding to the pandemic, but I think as you've heard, the tool is also being continually developed, and conceivably there are additional modifications that could be incorporated as time goes on. I think one of the practical challenges for those of you out there in decision-making positions is that the studies that are incorporated in the clearinghouse are from the past. And so nothing is going to be a perfect analog to what's happening in society today, but we're not going to find that anywhere. And so in many ways, that makes the clearinghouse the best place to go if you're interested in trying to find some of those short-term earnings outcome fixes, for example. One of the features that we didn't even talk about really in depth yet that I think might be powerful here is the ability to compare across interventions. So if you're looking at something around short-term earnings in responding to the current crisis, you can also look a little bit at the context of where those different interventions were applied, and maybe even some of them had been applied during periods of past recessions. So I think there's a lot to dig into here, but I think there's not going to be one perfect solution for every decision maker out there. And that's really the great thing about the clearinghouse, is that it puts the user in the driver's seat for exploring the information about what might make sense with appropriate context to begin addressing the kind of wicked challenge that we're currently facing in the pandemic.
That was really And just in our own selfish way to make use of having two such illustrious experts with us, you and Rachel, I'll end with this question, which is slightly twisting the wording that it has on the slide there. But if there's one additional piece of information that you think would really be useful for us to have on Pathways, I'd love to hear from each of you, and maybe Nick, I'll start with you first since you were just kind of going in that direction. But if there's one thing that we're missing that you'd love for us to work on, we'd love to know what you think that would be.
I think that one area that might be worth additional exploration is to the extent we can say more about demographic subgroups. So for studies stratifying by race, ethnicity, gender, age, and there's some details that are in the clearinghouse today, but increasingly as folks are interested in identifying how to apply interventions to particular subgroups where we truly are seeing great disparities across society, that subgroup analysis is going to be really important to delve into. And I realize this is incredibly hard. For some of us, we've been talking about this for years, and the studies themselves often have to be able to provide that information in order to incorporate it in a synthesis product. But as a society, I think this is an area where we collectively need to do much better.
That's really thoughtful. I appreciate hearing that. Thank you. Rachel, what about you?
Yeah, that is an absolutely great point. And that was one thing I wanted to touch on with this question as well. So thank you, Nick. I don't need to say more on that point. The only other things I'll add, one is perhaps a little bit longer term and perhaps more challenging. The other, I think, is a bit simpler. To start with the simpler one, I do think that when I think about states who might want to use this tool to think about how they could replicate and scale, a cost per participant type of metric is a very handy one, because a rural community in Montana looking at a rural community that has a bigger population somewhere else, that'll help them understand how to scale these solutions and what that might mean for them, at least in some rough terms. A bigger picture, kind of longer term item is, noticing, for instance, if you look at certain programs, you might see a positive short-term outcome, but what looks like a negative longer-term outcome. And I know that this gets into maybe, needing to dig into the studies, on the part of the user, but I can imagine a user really appreciating the ability to have a quick synopsis of kind of why that might have happened, if that's known or evident in the studies, or what may have contributed to that. For instance, is that because of external economic factors and kind of a coincidence? Is it some part of how the program was structured? Those, I think, are questions that might be raised by some of the data points that perhaps this tool could explore ways to more directly address down the line.
That's a really interesting insight. And, we're one of the, as Diana mentioned when she did the overview, in addition to the kind of data and to searching through all the data that's currently on Pathways, we also are doing what we call kind of syntheses to try to do kind of summaries that look across different aspects of the data that's in Pathways. And what you mentioned there seems like a really great topic for that. But Diana, I'm going to pass it back to you, because I'm hoping that we have some questions from the audience as well. And I'd love for you to take over and moderate those questions.
Sounds great. And we do have a ton of questions that have come in, so we'll jump right into it. First, I just want to introduce, we have Dana Rotz, who's the principal investigator for Pathways, and Sarah Whistle, who's the deputy project director, and they'll be helping with these questions as well. Let's go over one of the first questions that came in, and this is for Rachel, just hearing a little bit more about your background and title. So Rachel is with the National Governors Association at their Center for Best Practices. I think that was an easy one to cover. And then let's dive in. Sure, let's dive in. Dana, I think there are a couple of questions that I want to send your way in thinking about how we think about the effectiveness ratings and just backing up into what study designs are eligible for review. So that's the first question.
So in terms of what type of study designs are eligible for review, the Pathways Clearinghouse currently includes randomized controlled trials and comparison group quasi-experimental design studies. In terms of the effectiveness ratings, what we do is we examine all of the studies on a particular intervention that have received a study quality rating of high or moderate based on our assessment of the study's quality. And then we assign one of 6 intervention effectiveness ratings. The first of those is well-supported, and well-supported requires kind of 2 independent studies to have shown evidence that a intervention produces favorable effects in a specific domain. And then supported is the next rating, which is essentially requiring that one study presents evidence of favorable effects within a domain, and that there are no kind of other studies or other outcomes showing evidence of unfavorable effects.
Thanks, Dana. Oh, go ahead, please.
There's also 4 additional ratings, effectiveness ratings for other cases. Whether something has mixed evidence effectiveness, whether there's no evidence to assess support, insufficient evidence to assess, or insufficient evidence to assess support.
Thanks. And then kind of building on the part of the discussion that Nick started in thinking about the populations that have been disproportionately affected by the pandemic. Somebody asked a question about whether Pathways includes programs that are specific to individuals with disabilities. And I think there are some other questions about other populations like non-custodial parents. So Sarah, do you want to speak to that and how users may be able to navigate the site to find those?
I would love to answer that question, Diana. Thank you. So the short answer is yes. So within our search feature that Diana demonstrated earlier, there's an option to filter the results to those interventions that have served specific populations or populations facing specific employment barriers. And Pathways does include interventions that were intended to support people with disabilities, non-custodial parents, single parents, kind of a broad range. And so a lot of them are represented within the research. And we've set up that search so that you can find what's relevant to you and your clientele as quickly as possible.
Thanks, Sarah. All right. So we have another question about what are the differences between the Pathways Clearinghouse and the Department of Labor's CLEAR? And I'll turn that over to Dana, who's also Deputy Project Director on CLEAR, so she can speak to this one.
Yeah, so I'm lucky to be able to work on both of these efforts, so I'm always happy to talk about it. I think the key thing to keep in mind is the Pathways Clearinghouse is an investment of OPRE, within ACF in the Department of Health and Human Services. And what it seeks to do is identify interventions that aim to improve employment outcomes, reduce employment challenges, and support self-sufficiency for populations who are low income, and especially recipients for public programs such as TANF. The Pathways Clearinghouse was also designed for use by direct employment service providers and TANF administrators, as well as by other users like policymakers and researchers. So that's largely the Pathways Clearinghouse mission. And the Department of Labor's Clearinghouse for Labor Research and Evaluation, or CLEAR's mission, is a little bit different. And CLEAR aims to make research on labor topics more accessible to a wide set of audiences, including practitioners, policymakers, researchers, and the public more broadly. And the goal there is to inform decisions about labor policies and programs. And so CLEAR reviews literature across a wide range of labor-related topics, including on employment and training, like the Pathways Clearinghouse, but also on health and safety, worker benefits, and employer compliance. So the clearinghouses do have overlapping scopes, but their missions are slightly different, and therefore the way they kind of approach what they do is slightly different. That said, the clearinghouses are coordinated federal efforts given the overlap in content. While the scope for the Pathways Clearinghouse also includes research eligible for review by CLEAR, Pathways specifically focuses on the programs designed to meet the needs of populations who are low income or who face chronic barriers to employment.
Thanks, Dana. Let's see, we have a couple of questions and we still have time left, so folks, please feel free to submit your questions. This question, I can start this off and others can certainly chime in, but the question is about the attention that's given to qualitative data and thinking about data from the user's perspective and whether they feel a particular program is meeting their needs, no matter how smoothly or effectively the program process has been shown to be. But I think the broader question is what attention is given to the qualitative data. And as Dana has mentioned, the studies in the Pathways Clearinghouse, we really focus on information from randomized controlled trials and quasi-experimental lines with a comparison group. But for those interventions that do have at least a supported outcome, a supported effectiveness rating in one outcome domain, at least one, we are pulling more implementation information. So not necessarily information on the user's perspective of the program, but we are pulling in information so that users can see like details on the quality of services that are provided, whether, if there's information on this, whether a specific fidelity instrument was used as part of the study, or specific information about the cost of an intervention. So as part of the implementation details that we're providing for those interventions that have a supported outcome rating, we are trying to pull in additional information that can help users make decisions about a program, but not necessarily that particular set of questions that this person has asked about user perspective of the program. All right. So let's see. Okay. So this question is about the website demonstration. So the question is, the demonstration of the Find Interventions that Work feature focused on a search that used one filter, so the outcomes of interest, and we used earnings. Can you conduct a more expansive search? For example, let's say you're interested in the evidence for interventions that focus on cash assistance recipients, or understanding what particular services are available. And I'll take that one. But the answer to that question is yes. I showed a search using one particular filter, which is focused on the outcomes of interest. But you can also use the search really flexibly. You can use the search to generate the full of interventions that we've reviewed. But you can also tailor it to, like we've been talking about, really thinking about the specific populations that have been the focus of an intervention, like Sarah mentioned, or thinking about the specific services that were offered. And some of the examples that come up in questions, like, are there interventions that focus on apprenticeships? And yes, that is also included, or job search assistance. Those are also filters, and I think Rachel mentioned those as well. All right. And I do see other questions coming. Oh, just looking at the time, we are close to time. So I think we are going to head and start to wrap up. So let's see, with the few seconds we have left, this is just a heads up for folks about how you can stay connected with the Pathways Clearinghouse. You can follow at Mathematica Now or at OPRE_ACF on social media for the latest updates. You can also find us through the hashtag Pathways to Work. We also invite you to join the Pathways to Work email list, and you can do that on the homepage. There's a place to enter your email address and subscribe, so we encourage you to do that to find out both about future events and then other information about how to navigate the website. And then, of course, visiting the website, and the URL is listed here, pathwaystowork.acf.hhs.gov. And I am sorry we are out of time, but for more information, you can certainly send an email to the Pathways Clearinghouse mailbox that's listed here, or contact Kim Klum, the project officer, or myself, Diana. All right. Thank you, everyone, for your time today.
Thank you so much.